Dr. Anik Giguere, uh, supporting families through difficult healthcare decisions. She is a researcher at a VITAM Research Centre on Sustainable Health and a faculty member at Université Laval in Quebec. Her work focuses on developing decision aids that facilitate shared decision-making between patients, their caregivers, and healthcare providers. Her research is valuable to families navigating terminal illness because it prioritizes patient involvement in healthcare decisions despite cognitive limitations. By creating tools that help communicate complex medical information effectively, Dr. Giguère work, her work empowers patients to maintain dignity and autonomy while supporting caregivers through difficult healthcare choices that respect their loved ones' values and preferences. And that was basically what artificial intelligence specifically, perplexity helped us out with. Dr. Giguère, was that okay? The
Yeah,
introduction
I'm
by...
impressed. Wow.
Okay.
Sometimes I wonder if we're gonna be needed anymore.
Well,
I'd like to have an AI in my brain sometime.
Definitely fact checkers. That's important.
thank you so much. And we would really love to hear your presentation, Dr. Anik, and we're really very happy that you're here.
Okay, thank you very much. I see there's not so many people, and among you guys that are, can you just show a hand when are you a caregiver? People that are present today, raise your hand if you're a caregiver, or are you a professional, healthcare professional? Oh, fantastic. Are you a patient yourself, or more like a family member? Oh, okay, there's one there. So I made my presentation, I designed it more for patient families and caregivers, but you know, I'm used to also do presentations for healthcare providers. So whoever has question, it's going to be welcome to hear your thoughts. So let me share my screen.
And we'll let you know,
bit,
Anik, that
yes.
we'll have time for question and answer at the end of your presentation.
Yes.
So, yeah.
Perfect. If there's a burning question, I'm really happy to take it as well. Okay. So I might not be seeing you. You can interrupt me while I talk, no problem. I'm used to teaching at the graduate students, so I'm okay also if you want to interrupt and ask questions. So let's go. So I have no conflicts of interest to declare, no conflict of interest. So sorry, my first language is French, so you can probably hear it. So I may do some little mistakes. I want to tell you a bit more about me. This is my university. It's the oldest French speaking university in America. So Université Laval. So it's beautiful, Quebec City, very old, and it looks like a bit Europe if you want to come visit. So as Norman said, these are my two research centers, one of which is a research center on aging. And I just want to point out that I'm vice president of the International Shared Decision Making Society. So this is a professional association. We welcome mostly researchers are there, but we will eventually reach out to more patients and healthcare professionals. So you are if you're interested, I invite you to go see the website. And this is my team. So I'm mostly doing research in my day-to-day work. And I work with graduate students, so PhD, master degree students. And we are mostly doing research to try to improve implementation of shared decision making. And I started off in geriatrics with themes that were I started off with the family medicine, and I had all kinds of topics I was interested in. What are the decisions that are difficult inside the primary care consultation? And then I had a grant and I did a lot of work on dementia, people living with neurocognitive disorders. But Since then, I moved to more health promotion, so healthy aging. So you will see a bit of everything in my talk. So I've developed a lot of decision aids, as Norman said, maybe 30. So they cover all of these kind of topics. So I hope that, but I don't know exactly what you've had for a presentation. So did you, Norman, was there a lot of time and effort devoted to shared decision making, what it is, or you all know
Yes.
what it is? Okay, so maybe I can skip this part or go through very quickly. So what is shared decision making? What are its benefits? How to effectively use decision aids? And how to develop a personal plan to engage in shared decision making. So as I was saying, I really targeted more in my talk people who would go to see a healthcare provider and to prepare them for shared decision making. So we continually make decisions to choose what we eat, what we do, and also our healthcare. Making these decisions require weighing the pros and the cons of different options that are available to us. So I don't know if many of you are over 65, perhaps a few of you. So as we age, we have several decisions to make, and I wanted to take this as an example. We have decisions to make to choose the lifestyles that will allow us to maintain our independence, among which some decisions will touch on vigor, mobility, nutrition, social life, memory and attention, mood, sleep, or self-care. I'm just going to change my dashboard. Sorry. So for example, many of you have probably already chosen some lifestyles to age healthy. You could, for example, decide to do more physical exercise or brain exercise for your memory. And some of these decisions do not seem to be high stake or difficult, but they may become higher stake. For example, imagine that you receive a result of a test that shows that you may be developing a mild cognitive impairment. Then you might want to consider all the options very well, to maintain or improve your mental capacity before making a choice. So then you will try to consider all the options that are effective as shown by scientific evidence. So scientific evidence shows that several options may help maintain mental capacities for people who are starting to develop cognitive impairments, such as brain exercises, social activities, physical exercise, meditation, yoga, or Tai Chi, art therapy, or you could also consider not doing anything. You could call this watchful waiting or doing nothing, but this is also an option, and it's there, and we should not forget it, because when we make a decision, we can decide not to do anything. So if you consider, for example, to do more Tai Chi, then you will want to know, well, what are the benefits of Tai Chi? What are its negative impacts? Is there any inconveniences? And you want to see also, is it better or worse or than other options? So if you look at the benefits and inconvenience of Tai Chi and yoga and meditation, the benefits are that it increases mental abilities, and a side benefit that is very good, it improves also other aspects of your cardiovascular health. On the inconvenience side, it may cause nausea, joint or muscle pain, and it requires time. So decision making requires choosing the option that has the potential benefit that we are looking for. And you also want to choose the option that does not entail the inconveniences that you consider unacceptable. So when we are concerned about a decision about our health, we can discuss it with the health or social service professionals. That's what they're for. That's what they're here for to help us make this difficult choice. And this is called shared decision making. So it requires that we clearly express our concerns and preference priorities. And you can also in this way, the healthcare professional will think about our needs when discussing the different options. We can also ask our family or friends to help us make this decision. It's important to realize that there's no wrong or right decision, and we just have to find the right decision for us. So it's also normal to change our mind if the decision is important, and it can be discussed again with, with the advocate, or the professional. So in the context of shared decision making, there are two experts that take part in the conversation. So there's the healthcare provider who has expertise in care and services, knows the option and their pros and cons, but we are also the patient an expert because we are aware of our own priorities, values, preferences. We know our health history better. We have life experience also and resources. We cannot implement some options if we don't have the resources to implement them. So this is important knowledge to bring in a conversation. So shared decision making is meant to help make the right decision, and it involves the care provider sharing information about the options, the disease, the outcome probabilities, but on our side, we need to also share everything that's important about our values, preferences. Are we willing to take risks? Do we have experience of this illness? Are there any social circumstances are important, and what are our resources? And this leads to a discussion and eventually optimal care. And why is it optimal? It's because it's the care that on one side is informed by the evidence, but on the other side also is informed by our preferences. So what are the benefits of shared decision making? Well, it allows us to be at the heart of the decision that affect us. It allows us to manage our own health, to make choices that work for us, to be proactive about our health, and to have confidence in the lifestyles and the decisions that we choose. So how can we prepare to make a shared decision, a shared decision with the healthcare and social staff? Health and social care staff, sorry. Well, there is also information like available on this part, because often what we hear about shared decision making is what it is, and we try to train clinicians, but as a patient we also need to think about things. So there's education for the patient that should be known or distributed. So the patient needs to, before meeting a health provider, he has to reflect on the questions that the professional will ask, think about what's best, and prepare to respond to questions about themselves, ask question and express concern and say your preferences. So the type of questions that the provider may ask are you sure what's the best choice for you? What is the best choice for you? Do you know the benefits and harms of each option? Do you feel like you know what's most important to you regarding the pros and the cons? Do you have enough support? And for us, we need to ask questions also. We need to prepare ourselves to ask some questions in the consultation. So what are my options? What are the pros and cons of each option? How do I get support to help me make a decision that is right for me? Do I really need this test, this treatment? What are the risks? Are there simpler, safer options? What happens if I don't do anything? What are the costs? How long does it take? So this is maybe asking a lot for some people, but it's good to start thinking about it, to advocate for ourselves, Of course, the system should be meant to allow this line of questioning better. But if it's not, the climate is not available at the moment for you go in a consultation, the climate is not available for such type of questions. You still need to try to ask them, because it's in the end it's us that are going to be living with the consequences. And also, these questions, they are known to improve shared decision making. So there's evidence behind these questions that when patients ask them, it improves shared decision making processes. And how this research is really interesting, because they had fake patients enter consultations of several different clinicians, fake patients like they were actors, and they asked these questions and they checked afterwards what kind of behavior was in groups that had the questions and a group that didn't have them, and they saw that it really improved shared decision making. So now I'm going to talk to you about decision aids. I hope you haven't discussed this too much already, because it's going to be very boring. So there are several strategies to implement shared decision making. So there's patient decision aids, professional education as well. So usually when you implement shared decision making in a new environment, you have all of these elements, and also patient education. So the patient education is mostly these questions I showed you. So educating patients on how to ask these questions. So let's dive into the decision aids. So the decision aids work well to implement shared decision making in an organization and have become streamlined to facilitate it. So they can be in printed format, such as those that are represented here, but they can also be in video or in an interactive website. So usually they comprise the best available scientific data. There's a description of the health problem, the decision to be made. There's also a list of the available health options, the probability of experiencing benefits and harms, exercise to help patients clarify what matters most to them, and guidance on shared decision making. I'm going to present now one example. So this is a decision aid that I created longer. It's been a while. So I see it's December 2018. So that's the date of the evidence review. So probably published it like in 2020. So I decided to take this example because it's about advanced directive. In Quebec, we call it the protection mandate. So it includes the protection mandate, includes the advanced healthcare directives. So it's a bit broader. It also comprises, who is going to be your person in charge if you become incapacitated. So this was identified as a very important decision when we did a survey of people. The survey was with the healthcare provider of people with neurocognitive disorders. The healthcare provider cared for people with neurocognitive disorders. So they prioritized which decision were very frequent in their practice and the decisions they had difficulty discussing. Okay. So this was one of the 5 most important topics. So I'm going to walk you through this decision and just show you what it looks like. So it was a bit difficult to create this one. So it's a bit legal. So here you see, you have that at first, the first page, we always do this. So this is my template that I use all the time. So we always specify who the document is aimed at in the first page. So in this case, it's older adults living in the community and the caregiver of those people. And we also have an instruction what it is meant for. So to help prepare the person and their loved ones for discussion among themselves and with healthcare providers, to help patients and their loved ones choose an option that reflects their priorities. Then the decision aid, usually all decision aids have an introduction. So here you have how is incapacity defined, what is a protection mandate, what on the second page, who can consider preparing a protection mandate, the steps for what if the court determines that the person is incapacitated and they don't have a protection mandate, taking priorities into account. And we also always have a box that we try to emphasize with an eye. You see the little image where we have the message that's the most important in the tool. It's a recommendation to take patient priorities into account and share decision among healthcare provider, the person, and caregiver, if there is one. Then the working part of the decision aid, the part that's really very long to develop, and also the part that I think is very useful is the part where you have the benefits and harms. So you see, you put side by side all the benefits and harms. And in such case as the protection mandate, it's not the same as, you know, just having a procedure or medical procedure. This one required to be a bit creative to find the evidence. So for example, you have in the benefits, a benefit of having a protection mandate is that your end of life care wishes will be respected. So of 100 people who set out their end of life care wishes, between 50 to 99 will receive their desired care. So it's not 100%, as you see. So sometimes they will not receive the care they want. But the decision aid is it's typical of the decision aid to present numbers like it's more the chances that you will experiment the benefits or harms, and not only a list. If there's a data, then it's presented like this. You see, on the other hand, I'm not gonna read everything, but here you have a possible harm: non-compliance with advanced directive by loved ones or medical staff. So 37%, it seems that 37% do not receive their desired treatment. So this is a benefit, harm. So in this particular decision aid, we didn't have the watchful waiting. It was very special. So instead, we just presented what happens when the person doesn't have a mandate. So we describe in more details the various types of mandate. They're not mandates, but the way the person's wish, the way the decisions will be made in place of a person in case of incapacity. So that, I don't know if it's the same. It's probably not the same where you live, but there must be something like this. So in this case, we really focused on what people wanted. So when we created this, we showed it to people before finalizing it and made sure that it met all their needs. So as you can see, a patient decision aid can also be useful for healthcare providers, because then they will have the scientific information at their fingertips, and it allows to structure the clinical consultation, and they can be distributed to patients who must make a decision. And sometimes, you know, the decision can be delayed. You can tell the person, read this and come back, and we're going to make a decision afterwards. And for the patients, while they're useful, as I was saying, you can use them at home if you want to prepare before a consultation. They can be used in a consultation or afterwards. So there is a lot of research done on decision aids. So since 1999, there were 17 studies. Now we're up to 209 studies. And these are all studies that have tested if decision aids compared to no decision aids, if they improve healthcare processes and patient outcomes. And what the evidence shows is that decision aids indeed facilitate shared decision making. They improve the knowledge of users, decrease decisional conflict, and increase participation of patients in clinical decision making. So how can we find decision aids? So there is a collaboration that have established what is a decision aid, because not all information available is a decision aid. So there are criteria that you need to meet to be called a decision aid. So these are these criteria. The decision aid should describe the health condition, states that there's a decision to be considered. So if you don't have a decision to be considered, it's not a decision aid. So there's a lot of information that doesn't fall into decision aid category. You need to identify the target audience, list the options, including the wait and see or watchful waiting. You need to have a description of the positive features of option, the negative features of options, and to ask patients to think about which positive and negative feature matter most to them. So if you want to know more about the criteria, this will be available, as I understood by Norman. You could scan the QR code and you could go to see if that's collaboration work. So there are also decision aid directories. So this is really higher quality information. So it's, of course, if you can find the decision aid that you're looking for in these website, it's very good. So I just wanted to point out the PADA website. So this is a new website that I've created where people can develop decision aids. So if you're a care provider and you want to develop a decision aid, you could easily do an online version. It's if you have the content ready, it's almost like 2-3 hours. But developing the content, of course, is long, but at least you have something very tangible. I can show you afterwards. I wanted also to point this one, and I put an asterisk because this one has several on end of life of care. In the first page, also in my decision box website, I have several for neurocognitive disorders and end of life care. But you see this one, the first one, it's hosted in a website in Canada. It has 253. So this one is very, very big. And what happens if a website is in English? And, I wanted to let you know that you probably know that it's easy to translate a website now. So I'm going to show you this afterwards. So if you want to find a decision aid with your navigator, make sure to use patient decision aid in quotation marks, because if you just write decision aid without patient or any other terminology may not lead to a real decision aid. And I tried it, but you find a lot of scientific resources. So this might be, a bit long to sort. So if you are going to the directory and the decision aid is not in your language, you can find the automatic translation, choose your language, but then what's a bit cumbersome is that you will need to, and I'm going to show this to you. So this is my website, Healthy Aging. It's in French. So I just wanted to show you because this is incredible. So we were talking about artificial intelligence. So of course, I have a navigator that's in French. That's not very useful, but whatever navigator you're using, there's always a function for translation. This one, for Google, it's Chrome. I mean, it's here. And you see here, I just type like this. And now, wait a minute. You see now it's in English. So this is just the welcoming page. So if I go to memory, so this is really my Healthy Aging website. So every page, however, I need to do it again. So this is a bit cumbersome, but if you have a big decision to make, you might not mind taking the time to translate each page. You see, what are mental abilities? Who might consider maintaining their mental abilities? Common myths. So this is very interesting, I think, to have this possibility now to, sorry, I'm just gonna go back to my presentation. So in conclusion, When you want to make an informed decision, it's only you that can judge your values, your preferences, the benefits that matter to you, the inconveniences that matter to you. And you have to consider how you can use shared decision making. So we saw today that there are several ways that we can, or steps that we can take to facilitate shared decision making. So we can get to know the options and their pros and cons. And so then we will be more informed, find a patient decision aid about the decision, discuss with friends, family, caregiver about what matters most to you, make a list of questions to ask healthcare providers, and participate in shared decision making with a healthcare provider. And by taking this step, you can really be an expert and an advocate for yourself. So I think I'm not too bad with the time. I'm really happy to take any discussion, any question. I'm gonna try
Great.
to look.
Thank you,
Yes.
Anik. So I'll pass it over to Kim, and if there are any participants that have any questions, maybe we will grab those first.
Absolutely.
Yeah, we'll see if anyone has any questions.
Hope everyone's just typing away, right? Let's see here. Well, not just yet. Why don't I go ahead and ask you one while hopefully someone's
Yes.
um so what is the most effective way to address emotional resistance or that anxiety when discussing these sensitive topics like end of life care?
Um, so so when you want to make a decision about end of life care and someone doesn't want to discuss, you mean, or the
Yes,
person just
yeah, that
doesn't want to discuss? That's a tough one. Yeah, this doesn't fall too much under shared decision making. It's more like relationship building, and I guess, yeah, you have to find, I guess, well, I can answer, but it's not part of my research to do this. I'm also a caregiver of my dad who has neurocognitive disorders, and I've been contacting, maybe someone in the audience wants to answer, but I guess you need to find out why the person is uncomfortable. And, this is really relationship skills.
sure,
If it's not the good time, maybe, the person might also be uncomfortable. Maybe you took it too much information, it's really about, maybe you can go have a walk, try
right.
something else. I don't know. It's there. Barbara, did you want to share anything? Yeah. So,
Oh, actually, we did get a question, another question. So, are there shared decision-making tools that are particularly effective
mm,
when the patient is in denial of a terminal
ooh,
diagnosis?
that's the
It's
person is in denial. So this is not shared decision making either. This is really like, again, what's happening there. It's interesting.
uh,
So why would a person be in denial? Maybe,
I
I mean, I think I just want to say, I think the family is really important in helping when you have someone that's not comfortable. If the person is alone, I mean, I think it's too general a question. It's really, yeah, it's tough to answer this. I don't think there's any really like recipe for this. Unless you have one, Kim, do you have
right.
one?
And everybody is individuals, so one person may be comfortable with it and
Yeah.
another may not, and those members of the team too.
It's
However,
probably good to respect the person's wish not to talk about it. If a person doesn't want to share about it, discuss it, I think it's their right. But at the same time, as a healthcare provider, I would be very concerned that I would like to make sure that the person is not omitting to talk about it because of other things, because there's something that impairing their capacity to discuss. So I would you want to make sure that the person is conscious that so you don't want the person to be uncomfortable or doesn't have the right language or doesn't
Exactly. That comfort level for each one. You got it. Let me just.
I think that one of a good tool to use in this case is asking what a person's understanding of their current medical condition is. And that can kind of lead to information on, maybe how to have that conversation, or maybe that's a pathway into shared decision making, of touching upon some of those decisions that might be related to end of life care, but maybe not specifically calling it out, um, might be a tool.
if you tell the person that they have a terminal diagnosis and they rebut it, or I don't know what the word is, but they say no, it doesn't mean they didn't understand. It means that they don't want to talk about it, and it's their
Yeah.
right, I guess. Right?
Yes. Let's see here. How do decision aids I'm sorry, how do decision aids account for varying levels of health literacy among patients and caregivers?
That's a good one. So this is really interesting because people who have lower health literacy are the one that will have more variability in their healthcare. So we need to focus on them. Shared decision making reduces the gap between people who have health literacy and not who have a higher level of education and lower level of education. The decision aid itself, it has to be adapted. And so in our studies, we use printed and web-based versions, but even those sometimes can be, difficult. People do videos also, so this can be useful to people with lower education.
Let's and let me just check here. So, how can families overcome barriers such as hearing or memory impairments to ensure meaningful participation in care planning?
Yeah, so you're talking if someone has already cognitive impairment.
Maybe a
But
cognitive impairment or a hearing impairment.
okay. Yeah, so for each is different. So if we take cognitive impairment, so we did several studies, and even with moderate and advanced dementia, to see how we can involve the person in a discussion. The caregiver is key. I mean, right? So you need to ensure that the caregiver is fully participating. If the person is has incapacity, mental incapacity, then they cannot make the decision. They cannot really make decisions. But you're talking maybe before this kind of diagnosis, or right?
Exactly. Or
Uh,
sometimes the conversation doesn't start until well after a diagnosis, too.
yeah.
It can be really complicated
But
navigating.
I'm not sure you can have advanced care directive with someone who cannot understand, right?
Exactly. We need to start these conversations way sooner, don't
Early,
we? Yes.
exactly.
I
Exactly.
wholeheartedly agree that and education. So let's see here. Does anybody have any other questions, or I'll pull another one off the list? Um, So what does the role technology, including AI, play in enhancing shared decision making?
Well, now it's still an area in development. So I did a first study. We tried to use AI to develop decision aids, and it was very, very efficient in developing this, helping develop decision aids. So we framed this as a AI human collaboration because we didn't want to have only AI. As Norman said when he presented me, he disclosed, oh, this is AI. For decision aid, you don't want to have something that's only been developed by AI. Eventually, I think we can have also chatbots that could support the decision-making process. I'm doing another study where we want to train doctors into doing better shared decision-making by giving them feedback. So there are rating scales on what the behaviors for shared decision-making is expected from doctors. So if you record them and you transcribe them, usually we do this, really takes a long time, and we rate their behavior. There are 5 behaviors, but we're developing a system so they could have a real-time feedback on their performance, and so they could improve. And I was thinking also another idea, I don't know what you think of it. So we could have an AI system that would analyze the face and the behavior of the person to try to see if the person is feeling like being able to share, or more like, are they stressed? Or so the empathy could be more developed during the discussion. So there would be more so if, for example, the person is showing sign that they are uncomfortable, you could get a feedback to the doctor and the doctor could adapt. So I think that would be interesting.
Oh, absolutely. Let's see here. Probably have time for one more.
I think
So-
that might be our time for
time.
questions. Thank you so much, Anik and Kim.
Thank you.
Norman, I'll hand it off to you for our wrap up.
Thank you so much. That was a really awesome presentation, especially looking at the decision aids, the decision boxes. Anik, that was really awesome because before this presentation, I actually went to the site and started to look around and explore. It was really helpful to me. And it's an awesome digital tool. My question actually just wanted to ask the same question that I asked Megan earlier. Have you ever seen the use of a digital tool that allows families and healthcare providers to have digital conversations for end-of-life care planning or just shared decision making in say a private network where they actually can directly
So you're
communicate?
talking about video conferencing, or?
Actually, a way much like a social network, like a Facebook group,
Okay.
a
Like more
community,
like chatting?
more like chatting or like being able to exchange information using their devices.
Yeah, but what else would you need besides a chat?
Well, definitely chatting because we're exploring
Yeah.
ways to use our community for having families directly talk to their healthcare providers in a space.
Ooh, I don't think the providers will like that. If they have to answer patient on a chat, I mean, it's going to be a lot of responsibility for them. I'm not sure it's going to be, having an app, maybe a community support could work in this way.
Okay.
You could have a moderator that would be a healthcare provider that could, but I don't know, having patient chat to doctors all the time. Because I asked the doctors if they wanted to receive the summary of when someone did the patient decision aid. In my website, at the end, there's a summary of their decision. And I asked them, do you want to have access to that? They said, no, there's too much to handle.
Yeah.
So you have to ask providers too, not just patients.
Thank you so much. Because that's one of the things that we're exploring on doing in our community, and I'm sharing in the chat. a link to explore the community and see if you'd like to join, because we'd really love to have people over so that we can talk more deeply and hopefully get to collaborate and work on solutions together.
Yeah, that'd be great. Thanks a lot for sharing. I'm gonna check it. But there's not a lot of people who attend the conference. So is the community, how big is the community? Can I ask a question?
Oh,
Is it?
sure. Absolutely. We just started out, Dr. Anik, and we right now just have a few members. We're under in the 20 level. We're just 20 members right now, but
Okay.
definitely connecting a lot of new people and also people that have helped us in the past in this space. And hopefully you join, because we'd really love for you to be able to see how your work is changing people's lives over time.
Yeah. Well, fantastic. Thanks for the opportunity to present. I hope it was helpful.
Very
Very
helpful,
much.
especially since we're hosting the recording. And also, if you could share with me, just email me, Anika, your notes or your presentation so I can host it in the community. It will be wonderful for everyone to catch up, see what they missed, and hopefully in the community be able to continue the conversation together.